I just want to make a couple points. So what I'm hearing is that so that the Hyde Amendment is systemically racist is what I'm hearing in terms of the answers from the physicians on the call. But I believe refusing to cooperate with or pay for the destruction of someone's child is not an action against that person, but for them and their community. 70% of Americans agree with me on this. 60% believe that we should not have taxpayer funding of abortion. In my view, abortion is a failure to serve a woman in need. It capitulates to despair and it says there's no hope for that woman as a mother and there's no hope for her child. But when I look at some of the great Black Americans who are radically changing this country for the better, many of whom grew up in poverty, what if their parents had received and believed that message? Who would be making that change today? Supporters of abortion on this meeting should question whether the promotion of abortion itself is structurally racist, since it disproportionately affects people of color and class, and substantially reduces births to women of color to a much greater extent than white women. Planned Parenthood operates the largest chain of abortion centers in the United States and disproportionately locates those centers in or within close walking distance of minority neighborhoods. 10% of Planned Parenthood clinics are in majority Black zip codes, yet majority Black zip codes make up much less than 10% of zip codes in the United States. To me, this translates to Black lives lost. I don't know how you can see that any other way, especially when the founder of Planned Parenthood was an open supporter of eugenics. This was part of her goal, and we're buying into that right now. And when we talk about risk to women, there are studies, including a specific study of poor women on Medicaid in California. This is a recent study, it was released, showing a much higher death rate for women who have had abortions compared to women who have given birth, especially from suicide. I would ask the people on this call to support a longitudinal study of Planned Parenthood clinics where abortions are provided, of those women's mental health, of their physical health, and an actual study with statistical data that we can all look at and say, what's happening to these women's physical health? To pretend that there's no risk, I think the 99% risk-free comment it can't be based in science, and we have to be talking about statistical data here. I really support and am grateful for this. I'm grateful for this hearing. I'm grateful for the opportunity to talk about it. Ms. Bennett, I think you've really elucidated some of the impacts to women of color in this hearing, even though you're the minority witness. You've done a fabulous job of defending the life of minority children, 30% of whom have been aborted in the last number of years. Let's change that trend. I yield back.